Hello again, and welcome to Loomis Life Care. I'm Dr. Larry Thill. We're here to talk about another session of spinal segment. On this segment is T2, the second thoracic vertebra. The neck is the cervical spine. The middle part is the thoracic spine. Each of them gets a designation of a T number. So the second thoracic segment is T2, and it's right up here. So just below the neck, there's T1, T2. T2 has a very important job. So if the heart is dysfunctioning in some ways, maybe would it be a good idea to take a look at the electrical supply to it? That's what T2 nerves are. So the T2 nerve does have a particular responsibility with the heart, and part of it anyway is to manage the heart rate. So heart flutters. Why does that happen? Sometimes it's the nerve, part of the nervous system that goes to the heart that is the cause of that. Maybe it slows down as well. It's not just because there's a problem with the heart. Sometimes the problem is with the electrical system, the nerve, T2 nerve supply. What are some other symptoms or problems that can arise when T2 is misaligned? There can be some upper back pain, some stiffness of the neck, some rib misalignment off of T2, which can cause tension in the shoulders and again restriction of neck range of motion. How does T2 get misaligned? Lots of different ways. Any of the spine will misalign. We call that a subluxation, not a complete dislocation, but less than that. A subluxation is caused by any trauma, even slight. So a minor rear end accident, say, that can cause it. There are sports that cause, well, trauma, like football, falls in soccer, etc. Those can cause misalignment, traumatic misalignments or subluxations of these segments. And other things we wouldn't think about. What does just about everybody do today when they're looking at their phone? Our head is down, completely misaligning or reversing the normal curve of the neck, and that actually is going to affect the upper thoracic area. So T2 is going to be involved in that. So we want to bring that phone up. So what directions can this segment misalign in? Actually, it can rotate, it can rock back or forward. Usually a misalignment or subluxation is going to rock forward and also tip right or left. All of those things happen in the spine, and if that segment, this segment, T2, is subluxated in that way, it's important to know it really can affect the heart rate. So there's your tip for this week. It's T2. I'm Larry Thill, Loomis Life Care here in downtown Loomis for your spinal segment.